a baby is a special and exciting time. For some, especially first-time parents, there may also be a degree of apprehension as you approach the unknown journey ahead. This video will help you become familiar with our facilities so you feel more at ease when the time comes for the birth of your baby. The Birth Centre, Birthing Suites and Maternity Assessment Centre are on Level 2 of B Block. During your antenatal appointments, your midwife or doctor will speak with you about signs of labour and when to come into hospital. Public car parking is available opposite the main hospital entrance, and there is an undercover footbridge on Level 1 linking the car park and hospital. There is a short-term set-down and pick-up zone at the main entrance of the hospital. Short-term parking is permitted here if necessary. However, after escorting mum to birth suite, you should quickly return to your car and move it to the paid parking area to avoid any fines. If you go into labour during the day, enter the hospital through the main entrance on ground level or via the Level 1 footbridge from the car park. Follow the signs to B Block and take the lift to Level 2. If you arrive after hours, a number of entry points will be locked after 9 p.m. for security purposes. You can access the hospital via the emergency department on Hollows Way or via the Level 1 footbridge using the access intercom. When you arrive on Level 2, you will be greeted at the birth suite reception. Please remember to bring your pregnancy handheld record with you. You will be assessed in our Maternity Assessment Centre. If you are not yet in active labour, you may be advised to return home to give your body more time for labour to establish. If you are in established labour, you will be taken to one of our birthing rooms. A midwife will stay with you throughout your labour and birth. Each room in the birth suite and birth centre is equipped with birthing balls, mats, heat packs, a bed, seating for your support people, and also a private bathroom. In the bathroom, there is a toilet, hand basin, and double-headed shower. Most of our birthing rooms also have a birth pool. Each room has a fully equipped resuscitator ready to support your baby if needed, and we have a dedicated operating theatre on the same level as our birthing rooms. Our team of obstetric and neonatal doctors are available on site at all hours should you or your baby require any assistance. Many women like to use warm water to assist them in labour. Provided you and your baby are well and you have had a normal pregnancy, you may even choose to have a water birth. Hand hygiene is very important to keeping everyone, including your newborn baby, healthy and safe. You will notice hand sanitizer throughout the hospital, in particular when you enter the ward, outside and inside your room. All staff, patients and visitors should regularly wash their hands. If you require additional pain relief, there is gas available in every room. There is also the option of morphine, which can be administered by the midwife, or an epidural, which must be administered by the anaesthetist. Our midwives and doctors are here to support you, and we understand that every woman has her own needs and desires. You should discuss your birthing options with your midwife or doctor during your antenatal appointments and when you arrive in labour. The maternity ward has a combination of single bed rooms and shared 2-bed rooms. Bed allocation is based on clinical priority, not by request. Each bed has a call bell if you need assistance from a midwife. Each room has a bathroom and a dedicated sink for bathing your baby. There is a TV and free Wi-Fi for personal devices. After your baby is born, skin-to-skin contact is strongly promoted and commenced as soon as possible. If your baby is well, the midwife will support you with your baby's first feed, usually within 2 hours following birth. If you are both well, you may go home with your baby after 6 hours if you are with the birth centre or if you have chosen to have an early discharge. Otherwise, you and your baby will be transferred upstairs to our maternity inpatient unit located on Level 3 of B Block. Visiting hours in the maternity inpatient unit are between 10 a.m. and 8 p.m. Partners or a chosen support person may stay overnight if you are in a single bedroom. On the ward, there is a lounge area with tea and coffee facilities for you and your visitors to use. There is also a variety of shops and food outlets on the ground floor of the hospital. We provide babies' bedding, linen and wraps during your stay. Please have a read of what we suggest you bring to hospital on our website under the frequently asked questions. Mums usually stay between 1 and 2 nights after a natural birth. If you have had a cesarean or complication, you may need to be in hospital for a little longer. We have a team of lactation consultants that are here to help you with your breastfeeding, and breastfeeding classes are held on the ward every day at 9:30 a.m. We encourage mothers and babies to stay together. Unless your baby requires extra support, your baby will remain in your room with you at all times. In some instances, your baby may require admission to the neonatal care unit, where there is specialised equipment and staff to support them. The neonatal care unit is located on the same level as the maternity ward, and parents have 24-hour access to their baby. It is important to remember that you will need to have a baby car seat or capsule fitted in your vehicle before taking baby home from hospital. If you have questions during your time at Gold Coast University Hospital, please speak with your midwife or doctor, or visit the Gold Coast Health website for more information. From all of the staff here at Gold Coast Health, we wish you an empowering and positive birth experience, and we look forward to sharing your birthing journey with you.